Is Tuesday, I believe it's August the 7th, and I do detect a quorum. First item on the agenda is Resolution 2018-1340. Virtue and Gilmore are the sponsors, and I do have a letter from the sponsor. Accepts a grant from the Tennessee Department of Health to the Metro Board of Health to promote the proper use of all recommended vaccines and respond to vaccine preventable diseases in collaboration with the CDC and other partners. Do I have a motion?
So moved.
Second.
Any discussion? No, you want to briefly?
It's an immunization grant. We've had that for a long time. It's a certain percentage that we target to be able to protect the population. We're also getting some additional funds this year to help with the hepatitis A response. And so it's at the core of public health, and we've had that for decades.
Okay, and there's no local match on this, and a pretty good sizable grant. So any further discussion? All in favor? All right, recommend for approval. All right, next is RS 2018-1341, Virtue and Gilmore sponsors, and I do have a letter from the sponsor asking us to approve. Accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide an array of programs and direct patient care services to meet public health needs of Tennessee citizens. Do you have a motion?
So moved.
Second.
All right, any discussion?
It's another pot of money that we get from the state every year. It's one of our very flexible pot of money that we use to do different things, pay salaries, pay services, and different things. We do have quite a bit of flexibility with this money from the state, and it's very useful to us every year.
All right, anything further? Again, no local match. Any other discussion? All in favor?
Aye.
All right. So we recommend approval. Next is Resolution 2018-1342, Virtue and Gilmore sponsors, and I do have a letter from the sponsor asking us to approve. Accepts a grant from the Tennessee Department of Health to the Metro Board of Health for the Healthy Start Home Visiting Program to identify and provide comprehensive services to improve outcomes for eligible families who reside in at-risk communities. Motion?
So moved.
Second.
All right. Any discussion?
It's another one of the long-standing grants that we've had. It's the way that I like to describe this, it's one of those services where we look at the socio-economic determinants of health, where we go into homes and look at factors that may impact the health of children and adults there and intervene so that they can enhance the chances of having better health outcome. It's a very good program. It's a comprehensive program. We do assessments and we talk to them and look for interventions to make sure that their health outcome is on the positive side.
Okay.
Has there been any specific discussions and studies under this program regarding food deserts and the ability to have healthy food in the home?
As part of healthy home visiting, I don't think it's been, but if you really look at the contract, we use what we call best practices, which is really looking into literature and what's available, but it's not specifically related to food deserts.
It'd be interesting to see whether or not there's some sort of checklist or caveat, regarding just fresh fruits and vegetables in the home, and whether or not there's opportunity to be able to provide those things as part of the Second Harvest can help, as well as other local food markets. I know that a lot of, not just the Nashville Foods Farmers Market, but also all the community farmers markets carry surplus at the end of the market. There's usable food that they don't want to take back that can be donated, and sometimes that goes to Second Harvest, sometimes to Martha O'Brien, other places. To be able to access fruits and vegetables into the program might be helpful.
We will look into that, but just if it's not through this program, we'll definitely look into that, because this program can be very, very specific. So there are guidelines and steps, but we're going to look into how we can use those resources to assist families.
Thank you. Any further discussion? All in favor? right, recommend approval. Next is RS 2018-1343, Virtue and Gilmore sponsors, and I do have a letter from the sponsor asking to approves Amendment 1 to a grant from the Tennessee Department of Health to the Metro Board of Health to ensure federal preparedness funds are directed to Tennessee regional and metro emergency preparedness programs to prepare for, respond to, and recover from public health threats. Do I have a motion?
So moved.
All right. Any discussion on this?
This is our public health emergency preparedness grant, and we've had that for a long time. That's how we look at the threats, public health threats in the area, and prepare ahead and respond to when they happen. And we are deploying a lot of those resources now in responding to hepatitis A outbreak.
That's all.
And can you speak to why it's decreasing?
The funding, obviously, this is a grant that's a consequence of the 9/11 thing. So we do have up and down changes, but this is not significant enough.
No, it
to
isn't, I
impact
guess,
over there.
in the big scheme of things.
Yes, yes.
It isn't, I agree. All right. Any other discussion? All in favor?
I don't know what the favorite. Oh, go ahead. Go ahead.
Okay. All right. Sounds good. All right, it's recommended for approval. Next is RS 2018-1345, Virtue, Gilmore, and Allen, the sponsors. I do have a letter from the sponsor asking us to recommend approval. Approves Amendment 3 to a contract between the Metro Board of Health and Vanderbilt University, acting by and through the School of Medicine, to participate as a member site in the CDC Tuberculosis Trials Consortium studies. Do I have a motion?
Motion.
All right. Any discussion?
So this is a grant. Vanderbilt is a part of it, and that's one of sites across the world, really, international studies that's looking at better ways of managing this very infectious disease. And we're doing very well in Nashville, and we're learning different combinations of drug therapy to better manage these things, and we've been a part of several of these studies over the years.
Looks like got a pretty good increase in this one then, doesn't it? All right. Any other discussion? All in favor? And, okay, we
I
recommend,
did notice that
go ahead.
you seem to have skipped 1344. Do you see that?
Did we?
You did 1343, and then you went to.
And we went right to 1345? Okay, well, my bad. Let's go back to it. Let's go back to 1344, and thank you for recognizing that. RS 2018-1344 approves Amendment B to a grant from the U.S. Environmental Protection Agency to the Metro Board of Health to fund an ongoing program to protect air quality and to achieve established ambient air standards and protect human health. Motion?
So motion.
All right, any discussion?
This is our main air pollution control grant. We've had that for over 30 years now. It's how we monitor ozone, particulate matter, and check for trends, local trends, compare numbers to criteria what we call QAPS numbers, the air standard that you all see when we say we are in attainment or non-attainment, caution for sensitive groups. That's where that's what this money goes. So we have monitors across the county that run some of them continuously every 24 hours where we collect this data to make sure that we are in compliance.
Any other discussion? All right, all in favor? Okay, we recommend approval now. We'll skip to 1346. Am I on?
You were.
I'm on now? Okay, thank you. The RS 2018-1346, Gilmore is a sponsor. I do have a letter from the sponsor asking us to approves a contract between the Metro Board of Health and Columbia State Community College Health Sciences Division to provide clinical experience opportunities for students enrolled in its veterinary technology program. Do you have a motion?
Motion.
Second.
Any discussion?
Part of what we do as a public health department is to establish very good relationships with academia. And so we do provide opportunities for many of local schools and surrounding schools for practical experiences, nurses, in this case veterinarians, masters of public health students. So this is one of those that we do think it helps us in terms of recruitment, but also helps us to be a training ground for local public schools.
All right. Any other discussion?
And I just asked, do they assist in your dog care?
Yes, so they're learning, but we're also getting something back, because they typically will be for a few weeks, and you can speak more to that as to how that works. But there's a process of one student is there for how many months or how many weeks, and they are assisting our vets and helping out while they're learning. So,
All right. Any other? All in favor? All right, we recommend approval. We have a couple more. Now we'll move to RS 2018-1347. Gilmore is the sponsor, and we do have a letter from the sponsor asking to approves a memorandum of agreement between the Metro Board of Health and Vanderbilt University Medical Center Department of Allied Health to provide clinical experience opportunities for its students enrolled in the dietetic externship program. Motion?
Motion?
Second.
All right. Any discussion?
and that's very similar to the last one that I discussed.
All right, any further discussion? All approved? All right, we recommend approval. Now we'll move to RS 2018-1348. Gilmore is the sponsor, and we do have a letter from the sponsor asking us to approves a contract between the Metro Board of Health and the Nashville Academy of Medicine to provide access to the Charisma Soluse database for inpatient tracking and prescription tracking. Have a motion?
Motion?
Any discussion? All in favor?
Aye.
All right. We recommend approval. Next is RS 2018-1349. Gilmore is the sponsor, and we do have a letter asking us to approves a contract between the Metro Board of Health and Middle Tennessee State University to provide clinical experience opportunities for its undergraduate and graduate nursing program students. Motion?
Motion.
All right, probably seconded. Any discussion?
Same thing, very similar.
All right.
All right.
All in favor?
Aye.
We recommend approval. Now, we'll move to the next one. RS 2018-1350, Gilmore is the sponsor, and we do have a letter from her asking us to approves a contract agreement between the Metro Board of Health and the Centers for Medicare and Medicaid Services to provide information about the full range of qualified health plan options and insurance affordability programs for which consumers are eligible. Do we have a motion?
Motion?
Any discussion?
And this is what allows us to have access to enroll people in the Affordable Care Act by knowing available qualified health plans.
Any further discussion? Yeah. All in favor?
Yeah.
All right. This concludes the Health, Hospital, and Social Services Committee, unless anybody has anything you want to bring up.
No, I do have, we're at 62 cases, is that right? Of the,
Now we're at 70 by yesterday. So it's going to be a marathon based on what happened in Louisville, San Diego. But we continue to vaccinate more people. We're still targeting the same at-risk group of people who use drug, men who have sex with men, the homeless population. And we are reaching out to community partners and reaching out to at-risk people. We're going to clubs where people are. We're going to homeless areas. We are vaccinating in jails. But it's going to be ongoing for a while.
I know I talked to the publisher of Out and About magazine, and they did some online stuff, but please reach out to them. There's PSA opportunities there, both for the TV show on Channel 5+, as well as for the magazines.
And I appreciate you asking that question, Nancy, because I think, too, that we have to be very aggressive when it comes to things like this. So I don't know how often you're going to the missions and to those areas where we know that there's high traffic of those people at risk, but I would just inundate them consistently until we see some type of results of the efforts being made.
We are very, very aggressive. We are working we are on a regular basis going into those places and giving us. But if you like an update as to what we have done, where we are, I'll be glad to send that to you.
Well, I do get some of the information,
Because
but
of your day job, you get probably more of it than the rest, but I think it would be helpful if you're running a synopsis of the timeline, because this kind of stuff scares me. I can just think about the 80s, and so I don't
Yes.
want to come back 2 weeks from now and instead of 80, it's 800.
Yes.
Anything that you can do to help us track,
Yes.
bring attention to it, then that's what we want to be helpful.
We are now, thank you for the suggestion. We're constantly looking for opportunities, and like I said, we did get pretty significant help from the state. So we're actually trying to hire more people, have part-time nurses, so that we can have more groups of people, what we call strike teams, that's going to go into these multiple places and offer shots. So.
And I don't know if you have any flyers or any kind of cards in regards to that. And I know that my team is out quite a bit and we are referring people, but sometimes it's good if you can put something in their hands and say, look, we need for you to go do this, and make sure so it can remind them that if they feel at any point in time that they may have been at risk, that they need to, at least they need to go get vaccinated.
And we do have a lot of those, so I'll talk to you about how to get those across.
Okay.
We have a lot of flyers, and that's what we're looking for to
Right.
to get that out.
Well, I'll send my staff member a text right now and tell them they need to come over and get some of those flyers.
Okay.
Any other business? All right, thank you all for coming. We are now adjourned.
All right.